I have been doing work in cancer families, breast cancer genetics, and I can trace that back to my own family. My mother had breast cancer, as did many of my family members. My aunt had ovarian cancer, but we are not a BRCA1 or BRCA2 family. So most of our
Judy,
work,
maybe just tell everybody exactly what that means, BRCA1 and so on.
Oh, I bet this audience knows quite well. But you know that over the last 15 years, it's become clear that some women have inherited risk of breast and ovarian cancers because of mutations in two very specific genes that were named BRCA1 and BRCA2. And you can ask the founders whether it was really breast cancer 1 and breast cancer 2 or Berkeley, California 1, where the first gene was mapped. I'm not sure. And the ovarian risk gets short shrift in the title, but nonetheless. These genes were first mapped in 1990, and I know this because I had my son. I was in the hospital on at the delivery when the gene was announced, and I thought, that's it, my work is finished. Little did I know that I could spend the next 15 years trying to figure out the best ways to help women think about whether they wanted to know this information about risk and how to take care of that risk. And so we've spent time with our collaborators, many of whom are funded by the Breast Cancer Research Foundation as well, trying to understand the best ways to do testing, the best ways to analyze the genes, the best ways to do monitoring, surveillance, when to start, when to stop, what kind of surgery to consider, since at the moment that's still our best preventive. And now we have some clues from studying how these genes actually work. And BRCA1 and 2 are very important in helping the genome to maintain its integrity, by which I mean that when cells divide, they have to reproduce every one of their genes exactly correctly, like the cell was, the parent cell and the daughter cells have to be exactly the same. And you can imagine that in that process, cells make a lot of mistakes. And there are a lot of systems for fixing those errors so that things will be perfect every time. And BRCA1 and 2 are involved in that. And when they don't work, then it's easier for the cells to make mistakes. Why those mistakes are most important in the breast and ovary, and that's where the cancers develop as those mistakes accumulate, that's still quite a mystery. But understanding that about these cells has recently led to some very interesting and exciting findings about treatment. So I know this is about prevention and detection, but there are now some actual possible advantages, in a funny way, to having had your breast or ovarian cancer because of one of these inherited factors, that treatment might be different for those. And that work is very much funded by the Breast Cancer Research Foundation. Still, I would say we have to make a commitment to the daughters of our current patients and to our patients that things not continue this way. So we're interested, of course, in other ways to try to prevent. Do you want my water? That are not related to surgery, but are related to the lifestyle factors that modify risks, even in women at the highest inherited risks, that we are studying some hormonal factors that Mark will tell you about to see if we can modify risk. And of course, for all of the families like mine that are not BRCA1 or 2, but still have too much breast and ovarian cancer, we're still looking for other genes that might help to explain this, not because we want everybody to have a test to show what you're going to get or how much to worry, but because it seems, well, now proven that the interaction between your genes and your lifestyle and the things in the environment do determine what kinds of things will happen. And if we know where our risks are higher, maybe we can have a more intelligent way of trying to navigate our lives and our children as well to avoid breast and ovarian cancers in the future.
Right. So I just want to underline that last point, is that because of the discoveries in genetics, there are a substantial number of women who can actually do something to prevent, or I should say reduce their risk substantially. And by that I mean they can eliminate 90, 95, 98% of their chances of getting breast cancer, and that is a substantial gain that wasn't true before 1990. All we had then was worry. Now we have an answer. It's very exciting.